This is a 67-year-old diabetic patient on oral hypoglycemic agent who came to me with acute coronary syndrome. His coronary angiogram showed a 90% long, fibrous, calcified tubular stenosis in the proximal and mid segment of a type 3 LAD artery. I initially attempted to dilate the lesion with a high pressure NC balloon and a cutting balloon, but the lesion was undilatable. Hence, I decided to rotablate the lesion and then stented it with a drug-eluting stent in this diabetic patient. This is the floppy rotawire, 325 centimeters in a plastic ring with a Rotatorquer clipper. This is how the Rotatorquer clip should be clipped on the rotawire. The plastic ring has to be flushed with saline 3 to 4 times to lubricate the wire. This is before you remove the wire from the plastic tube. This is the floppy rotawire. The tip is 0.014 inch. This is a Y connector on the guiding catheter. This is loading of the rotawire at the distal edge of the Y connector. This is a 1.5 mm rota burr, the most common sized used burr. This is snapping a new wire in the interlocks and pulling back the brown sleeve over the interlocks. Tug gently to see that you have got a secured lock. There are 3 connections on the advancer. This is the white transparent tube which is to be connected to the nitrogen valve on the console, which gives nitrogen pressure and compressed air to rotate the turbine. This is the tachometer black cable which is attached to the console for the RPM speed, and third connection is the saline drip which consists of a cocktail of heparin and NTG. So there are many connections on the console. The nitrogen valve connection, which you can see, a tachomotor wire connection which gives the RPM speed. This is the rotation knob to adjust the RPM, that is the power switch. And here you can see the procedure time in the RPM display and the Dynaglide green light on the rota console. The rotawire is now removed from the plastic tube and it is being wiped with wet gauze pieces. This is basically to lubricate the wire. Always keep the rotawire straight and avoid any bending or kinking on the rotawire. This is the 1.5 mm rota burr which is being loaded on the rotawire. The wire is being exited out of the advancer. So here you can see the wire being exited out of the advancer. The Rotatorquer is being clipped on the wire. The Rotatorquer works as a brake. This is the saline flush which continues when the burr is being threaded over the wire to keep the rotawire lubricated. One has to use the principle of draw. We have to continue the drip, very important. This is basically to lubricate the wire. Also the advancer knob has to be kept 2 to 3 centimeters at the distal end. A clip on the wire to apply the brake. This is the formula of draw, looking at the drip, foot paddle pressed to adjust the RPM. The third thing is to check the wire clip. RPM has to be adjusted. You see an extra backup guiding catheter with a BMW wire and 2.5 by 12 cutting balloon. The lesion is still unopened. Hence, I decided to use a rotablator. This is rotating at a speed of 200,000 rotations per minute, and we continue until there is no fall in the RPM and there is a smooth run to ablate the diffuse calcified plaque. Begin again and continue burring until there is no resistance and there is no fall in the RPM. Once there is a fall in the RPM more than 5,000, withdraw the burr. Give some time. Do not burr more than 20 seconds. Constant RPM means that the calcified lesion is being successfully rotablated and there is a smooth run with no resistance and no fall in the RPM. A check angiogram after rotablator shows that the lesion is well open. A 2.75 by 28 resolute underward stent is being deployed at 20 atmospheres and this is the final result after deployment of the Resolute stent. So this becomes a case of a rotablator in a calcified fibrotic lesion followed by stent implant. This is a dynaglide mode before removing the burr. The burr is removed on the dynaglide mode. The burr is out now. When removing it, it has to be kept straight. Keep the assembly straight to prevent any bend on the wire.